The revision rates are very high. Very young individuals, high-level athletes, hyperlax individuals, 20 to 40% across various studies across the globe. So what is lateral extra-articular tenodesis? Good afternoon everyone. I am Dr. M.P. Khan, orthopedic and knee consultant attached to Critical and Cephi group of hospitals. Today I am going to touch the topic of lateral extra-articular tenodesis in a case of ACL reconstruction. Initially, for an ACL tear, most of us used to do ACL reconstructions. But what we have seen across the globe that the revision rates are very high in very young individuals, in high-level athletes, in revision surgeries, and hyperlax individuals. So the revision rates are close to almost 20 to 40% across various studies across the globe. And what people have realized over the last 5-10 years is that if you add another ligament, that is lateral extra-articular tenodesis, in addition to your ACL reconstructions, the recurrence rate or the failure rates have come down to as low as 6 to 12% across various studies in the next 5-year follow-up. So what is lateral extra-articular tenodesis? Basically, when you have an ACL tear, you also have an associated injury of the anterolateral complex. Basically, the capsule, the tear of ALL ligament leads to a rotatory instability. And when you reconstruct an ACL, so ACL gives you that stability, but the rotation stability doesn't come. So in individuals who are very young, indications are very young individuals, say like 17 years, 18 years, 20 years, especially who are engaged in high levels contact sports like soccer, rugby, and hyperlax individuals. There are individuals who have hyperlaxity in those cases, and in revision cases, when you're doing your ACL reconstruction for the second time because of failure due to any reason, in these cases, lateral extra-articular tenodesis is recommended, and it is done by using your TFL, that is tensor fasciae lata, which is on the outer side of your knee joint, and it is an extra-articular ligament. So basically it is not run through arthroscopically, it is done through an incision of around 5 to 7 centimeters on the outer side of the knee. It gives an additional rotational stability to your knee, and that is how it protects the native ACL graft that we have put for your ACL tear. So now the studies have shown that the recurrence rate have come down to as low as 6 to 12% after doing your lateral extra-articular tenodesis, and I have started to use lateral extra-articular tenodesis very commonly in young individuals and individuals who are engaged in high-level sports and hyperlax individuals. Thank you.